Let's talk about verification bias, or also called workup bias. Workup bias. So let's understand this bias with an example. Let's suppose a company has developed a test called test X for diagnosis of cervical cancer. And what is the gold standard for diagnosis of cervical cancer? It is biopsy, right? So let's suppose this test is X is conducted in 1000 populations, and among 1000 population 800 tested positive and 200 tested negative. It means that 800 had cervical cancer and 200 do not have cervical cancer, if you go by this test. But we want to confirm this, so we also do biopsy in these 800 cases. So among these 800 cases we do biopsy, but since it is negative in these 200, so we won't do biopsy in these cases. But let's say this test has some fault, and among these 200, let's suppose 40 have cervical cancer, let's suppose, and 160 do not have cervical cancer. So you are missing these 40 cases in the community, right? And you are claiming that this population does not have cervical cancer. So what does it mean? It means that you are overestimating the sensitivity of the test, overestimating, because you are missing the cases of cervical cancer in the community, but you are telling that its sensitivity is high, right? So in fact its sensitivity is low, because you are missing the actual cases in the community. So its sensitivity is low, but you are overestimating its sensitivity. So how to avoid this type of bias? So for that you have to select some random populations from these categories. Like let's suppose from 200 you selected 50 cases, and in these 50 cases you subject them to biopsy, and biopsy report showed that among these 50 cases 10 had cervical cancer and 40 do not have cervical cancer. So let's see, among 50 cases you are seeing that 10 has cervical cancer. So in these 200 cases, if you extrapolate to 200 populations, about 40 have cervical cancer, right? So to minimize these types of workup bias or verification bias, you have to select some populations, some random samples from the categories who tested negative and subject to this gold standard test, biopsy, right? Then you can know that, oh, this is actually overestimating the sensitivity. In fact, the sensitivity of this test is low, but it is showing it has high sensitivity, right?